How do modern colonoscopies remove even the smallest polyps? Imagine a tiny polyp hiding in your colon that could someday turn into something more serious. Modern colonoscopies are designed to find and remove these small growths safely and effectively. The process starts with a high-definition camera attached to a flexible tube called a colonoscope, which is gently inserted into the rectum and guided through the colon. Advanced imaging technologies like narrowband imaging and chromoendoscopy help doctors see even the tiniest polyps clearly. These tools enhance contrast and detail, making it easier to spot small lesions that might otherwise be missed. Once a polyp is identified, the removal method depends on its size and shape. For very small or tiny polyps, the most common technique is called cold snare polypectomy. This method uses a thin wire loop, or snare, that is placed around the base of the polyp. The snare then mechanically cuts through the tissue without using electrical current. Because no heat is involved, this technique minimizes risks such as thermal injury, bleeding, or perforation. Cold snare polypectomy is highly effective for removing small polyps completely, often in a single piece, which helps ensure no tissue is left behind. For larger or more complex polyps, doctors may use advanced techniques like endoscopic mucosal resection or endoscopic submucosal dissection. Endoscopic mucosal resection involves injecting a solution beneath the polyp to lift it away from the deeper layers of the colon wall. This makes it safer to cut out the lesion, often in smaller pieces if the polyp is large. Endoscopic submucosal dissection is a more precise method that allows the doctor to carefully dissect and remove large or flat polyps in one piece. This technique is especially useful for polyps with early signs of cancer because it preserves surrounding tissue and allows detailed examination of the removed tissue. Modern colonoscopes are equipped with tools that help control bleeding after polyp removal. Hemostatic gels and clips can be applied to the site to prevent bleeding, especially when larger polyps are removed. Managing patients on blood thinners is also carefully considered to balance bleeding risks with overall health safety. In summary, modern colonoscopies remove even the smallest polyps through a combination of high-tech imaging and specialized removal techniques. Cold snare polypectomy is the go-to method for tiny polyps because it is safe and effective without using heat. Larger or more complex polyps are addressed with techniques like endoscopic mucosal resection or endoscopic submucosal dissection, which allow for complete removal while protecting the colon's integrity. These methods are based on current medical standards and help reduce the risk of colon cancer by catching and removing polyps early. If you are concerned about colon health or polyps, always consult with a healthcare professional for personalized advice and care.